on April Fool's, and nobody picked me up, and I broke my ankle. And it was just
How did that happen?
I was playing tennis.
Trying to have a balanced life.
Yes, yeah, at the cost of your sleep.
Yeah. Riya, thank you so much for agreeing to chat to me. We'll hopefully get Carl, your business partner, to come chat to us too at some stage if we can convince him to speak on camera. So basically what I'm trying to do with this channel is to guide doctors that don't quite know or haven't been taught the challenges of being a doctor in South Africa or just kind of starting a GP practice. And this is just kind of things that I feel like we haven't been taught in medical school. And I don't think it should be left to kind of finding it out along the way. But let's just start with you firstly. So how did you get into medicine in the first place?
I don't remember wanting to do anything else.
Okay.
So I think from the time we were thinking about careers in sort of grade 9, medicine was my thing. To the point that when I was applying, I didn't actually want to put down second choices. I know that was very stubborn. So my parents convinced me to pick a second choice that was kind of giving you a few options. Like,
and do you know how the idea came to you? Do you have kind of any doctors in the family or?
My dad's brother's a max fax, but through the dentistry route. My mom's in speech and audio, so health adjacent or health related very much, but not doctors as in we know. I think I just liked people, in all honesty, and like working with people was a very big pull, and then like feeling like you could help people was important. So.
And if you kind of look back and how you grew up, was that your kind of your trait, helping people or wanting to fix things, or?
I think so. Like if I look back to, I think I was in grade 3, and there was a little girl who was my mom's friend's kid who just started in grade 1, and so every day this little girl was crying because she, didn't want to be without her mom, didn't want to be at school, and so like I was a babysitter, or like I took it on upon myself to just like keep her company, make sure she was okay. Like so I think that was a trend in my nature from early.
All right, nice. Okay, and then where did you study?
I studied at Stellenbosch. With me. Fortunate enough to get in straight out of.
And was that where you wanted to study, or is it kind of one of the choices?
I mean, ideally I wanted to go to UCT. I think just because a lot of friends from school weren't actually studying medicine, but were just going to UCT. So for the sort of social side of it. But in our orientation week, just seeing how different things were, I was sold on Stellenbosch already. So.
All right. And are you from Cape Town originally?
I was born in Durban, but moved at the age of 12. So Cape Town's very much home, like family all here. All right. So what was kind of your goal? So you got into medicine. Where did you do internship and community service? So going into medicine, I thought I would be a pediatrician. I just always liked peds, and I did my sort of job shadow time in peds. I actually forgot, I had my dad's cousin was a pediatrician, so that's also part of the influence, I think. And then got into medicine, still enjoyed peds a lot. Didn't enjoy the pediatric department and how they treated each other. Mostly quite competitive, not
in
very
terms
supportive.
of the doctors, how they treated each other.
So that was quite a factor in not wanting to go into peds suddenly. Just kind of seeing what those years would look like.
So obviously with you kind of got into it for the people. So when the people are very
so you want to be in a nice environment where people support each other. And like, I think where first and foremost your patient comes first, and I'm like, if you can't be nice when there's kids involved, I worry about you. But went through internship at Tygerberg. Got second rounded, got placed there, and sort of just made the most of whatever department I was in. Enjoyed it, but a lot of them I wouldn't necessarily say I wanted to stay in. And my very last rotation was family medicine, and I went to Khayelitsha, did clinic time there and emergency center time for my last month of internship. And just fell in love with it.
What did you fall in love with? Like what part of emergency medicine?
The team.
So again, the people supporting each other.
Just created such a family environment. You really felt like they had your back at every step, but also just, little times like taking a coffee break together was an important thing there. So it really made you get to know your colleagues on a different level, and also the different departments would come down to that coffee. So got to know them.
Okay.
So that, and also just I think I liked the adrenaline and the intensity and how quick things moved. So you really felt like you were doing medicine.
Yeah.
A little bit of a superhero moment, which was quite nice suddenly after feeling like you were in a little bit slow-mo sometimes in the big woods in Tylerberg.
Departments that helped each other, but there were also times you felt as a junior doctor not supported. Kind of, how did you deal with that? So kind of surviving internship or surviving
so that was interesting. My worst experience in internship actually happened in my first week. So in orthopedics, my registrar and consultant were both gone to conferences, and so I was doing the rounds alone. And I had a guy who they didn't realize was on blood thinners, bled out dropped his hemoglobin by like 5 points, which was significant. He just happened to have a high starting hemoglobin, so he wasn't critical.
Okay.
And I phoned internal medicine for advice and got screamed and shouted at. How dare you talk to me? Where's your registrar? And I was like, they're on a conference. The other consultant's also on a conference. Like, it's just me in the ward.
Yeah.
So I'm really just phoning because I needed advice, but it's okay. I will go sort it out by myself. Went and had a cry in the toilet, figured out what to do. Fortunately, the doctor that was not so nice did phone back to apologize, but that I think was like one of the times where you really felt like I just was a student last week. Like, I don't know better.
Yeah.
But going forward from there, I think I was lucky enough to feel supported most of the time.
Okay.
And then we did lean on each other as interns quite a lot, which was helpful.
Okay. Yeah, I suppose it does help. Being at Tygerberg, it's an academic institution.
Yeah, there's masses, you're a group of like 16 interns per rotation or something.
Yeah.
So,
and ComServe, where did you do ComServe?
At Mitchell's Plain.
Okay, so also quite a big supportive place.
Yeah, and that was also an emergency with the team sort of environment, and that just cemented the love for that kind of work and that atmosphere.
All right, so mostly quite a supportive kind of junior doctor here, which is quite nice.
Yeah, and I think I then tried to make that an emphasis for when we had juniors coming in, students, interns, exchange students.
Okay, so kind of passing it along. And then after ComServe, what did you do?
So after ComServe, my plan was to get onto the ships.
Okay.
But that took a little bit longer than expected. You need to do a Dip PEC and
how did you hear about ships? Like, how did that concept come about?
I think through some friends that also were sort of in that emergency sphere.
Okay.
So friends, I think the closest was one of my friends who was a year ahead, so was in my ComServe applying to ships.
Okay.
So that's kind of ignited that flame.
Okay, so and then to get on ships, you knew you had to do your diploma in emergency medicine. Had you done that already, or
no?
That was part of your plan.
I did it at the end of So I did it at the beginning of the year after my ComServe. Okay. So I just felt it gave me the time to study. I'd also heard that they did appreciate at the time having some time in private emergency rooms as opposed to just government, because it was a different
and more of a private institution.
Yes, and just different medications and having access and things like that. So I did a lot of locums for that, most of that year actually, in private emergency rooms around Cape Town, and then I actually got a sort of permanent locum post for the rest of the year at Kailicha at the time. Okay. So running a team in the emergency room with Side. And then I actually got offered or interviewed for a post at Mitchell's Plain, and then got like a proper full-time post. So ended up back at Mitchell's Plain.
Okay.
And then the following year got offered a ship position.
And obviously because you keep kind of going on, you enjoy the supportive environment, you enjoy emergency medicine. So with having a job at Mitchell's Plain, what made you not want to kind of stay there? Did you ever consider not going on ships, and since you were in that environment that you like?
I felt like Mitchell's Plain would always be there. Like the team would always be there and the support would be there. So it was one of those things where I felt like ships and traveling was something to do while you don't have attachments and you are free to do so.
What is the process of applying to ships? So so you mentioned you need to do a diploma of emergency medicine.
Yeah, I think for my own sake, I was glad I had it and had the time.
Yeah, I think it's quite good training, Okay, so you've got your diploma, and then what is the process of applying?
Yeah, so I got in contact with a recruitment agency. There's two that I know of in Cape Town, but you just need to go to one. They won't compete with each other.
Okay.
So you submit your CV, your supporting documents. If you haven't done your APLS or PALS, ACLS, ATLS, it's a good time to get that all done because they do want those. And yeah, then they did a clinical interview. Oh no, sorry. First they did just a general interview just to see what your personality was like and have you understand what that life might look like and see that you're a good fit potentially. Then after that, you did a clinical interview, which was much like a medical officer job interview, quite in depth on the clinical. And then thereafter, if they kind of sign you off for that, you're just in limbo, sort of waiting for a post to or a ship to need a doctor.
Okay. And then, so now they've given you the job. What was that like, that kind of getting to your first contract? And what was your first contract like? And where was your first contract?
It started in Australia and New Zealand.
Okay.
On April Fool's. And nobody picked me up at the airport, so I thought that was a really terrible April Fool's joke. So Australia and New Zealand for very short, like 1 week, and then we did a 1 month crossing to Alaska, which was a very interesting start to a contract. Yeah. And I do recall my senior saying, you either impressed or made somebody very angry at head office to be on a crossing on your first contract. But it turned out to be actually quite calm and manageable, that crossing. It was a very old population on board. I think the average age was over 80, like 82.
Oh my gosh.
So very much geriatric medicine for that one.
And which is obviously quite a change from what you were doing. So how did you find that actually kind of practicing on a ship?
Yes.
Geriatric medicine, working in a small team compared to the big supportive teams you had in the hospitals. Like, how was that transition for you?
So it was really interesting. Also, just transitioning from South African sort of base of medicine to American base of medicine. I found we were running more tests, more investigation, a little bit more defensive in your style of medicine, and just a lot more interactions with medications and things like that, just because people were on a whole list of medication. It was very nice to have an experienced senior doctor, so somebody that you could really trust their judgment on those calls, because it was quite an adjustment. And
it is very different.
You also suddenly had access to medication, which was not our standard South African, antibiotic choices and things like that. So learning curve for sure that first month. Yeah.
And did you, obviously the South African patients as well, the clientele is very different to kind of Americans or Australians. Did you kind of like that, or did you find it quite challenging dealing with, obviously now, patients where you have to practice defensive medicine, and that can be difficult? Was that tricky to deal with?
I was quite nervous about it because, of I think the idea we have of how aggressive American patients can be with litigation. But I actually found that people were very nice. Okay. I blessed in my 2 years to really not have difficult patients at all. So that was quite a relief. It was quite nice to not have a language barrier at all because they were all English speaking. So I also found I could explain better than sometimes when somebody is also a first language speaker, where I can explain a rudimentary thing, but I lack the power to be empathetic in the same way and get them to understand that I'm trying to support them in many ways. But so that was it was actually surprisingly better.
Okay. And then obviously, so now you've left ships, and what kind of made that decision to leave? So you were saying it was kind of a short term, you wanted to travel, try something new. So you reached the end of that where you thought, okay, so it's holistic end. How did you kind of transition back to land medicine?
So my plan was always to come back and get back into emergency medicine. So I sort of had this 2-year framework in mind because of the way the contracts work and things like that. COVID threw a spanner in the works. Ended up doing about a 6-month contract where it took over from me. And I think that was the push I needed to say, I don't really want to come back for another contract like this. Like, you know, one day in the future, maybe when we're sailing again, it would be a nice thing. But it was quite a emotionally draining experience. And yeah, so I was excited to come back and get into a Ridge program and pursue that emergency medicine field. And I just so happened that I got back and Mitchell's Plain was having interviews a week or two after that.
Oh, wow. Okay.
So sent in my CV, fortunate enough to get a post again. And rejoined them, I think 2 months after arriving back, which was, I understand, very lucky.
Yeah.
Because I know that
was during COVID still, so was that quite challenging?
I came into still full-blown COVID, you know, running 2 emergency rooms. Tough times intubating staff from the hospital.
Oh, wow.
It was not easy. So even when I was back, when COVID first hit, I just did locums there with the team and things. I think I felt I never really was that far removed in some ways during that whole COVID run for them.
All right. Okay, so you're working back in emergency medicine in Mitchell's Plain, so this was kind of always the goal and always the plan that you started out with. Then what changed? Because now you're not in emergency medicine at Mitchell's Plain. So at what point were you like, okay, this dream is no longer my dream? Yeah, so it was interesting. I was actually working with the team that I enjoyed working with the most during all that time, and I broke my ankle. And it was just... How did that happen? I was playing tennis. Okay. On a flat surface, no obstacles inside. No, just running to the net. Okay. And so it was a really small avulsion factor. It just needed some time off. Okay. And I suddenly had a month of sleep and no stress. And I just realized how good you feel when you just have a regular sleep cycle and you can like look after yourself, make good meals, just prioritize like health and well-being. And I went back into December in Mitchell's Plain, and one night I just remember standing there going, if I never see another stabbed, drunk, rolled in the dirt patient who's like, you know, really combative, and it would just be a really nice thing to never endure that again. Even though I did feel we made a difference often, like those kinds of cases were frustrating. And then those long weekends in December, you just have them coming at you all day. So I just realized that like this was probably one of the nicest support structures in emergency medicine, and if it wasn't exciting to do the trauma side anymore, there really wasn't much point in carrying on for another 4 years of specialty, knowing that you don't actually enjoy that side of it. So I'd enjoy the medical side but not the trauma side anymore. So it was... So you're saying you only kind of realized this once you had a break. So when you were in the stress, did you not realize at that point that like what your body was going through? No, I think you normalize it. So I went straight in from, internship and all your shifts there into emergency. Even ships, it's not quite a normal cycle, as you know. And I think I was actually pretty good with managing the like weird hours of sleep. So that wasn't too bad of an obstacle. And then I would just sort of burn the candle on both ends a little bit. And like, so when I was off, I was trying to do all the fun things I could to like replenish myself. Try and have a balanced life. At the cost of your sleep, probably. So I think all things considered, like I actually did really well during my time doing those crazy hours. So I just tried to maximize the hours I did have away from the hospital. And I did love the adrenaline and the like feeling like I was making a difference. So as tough as shifts could be, I felt fulfilled at the end of it. So I didn't, and until that kind of tipping point, I actually really enjoyed it. Okay. Yeah. And do you think that's like a South African mentality, going from internship where we do work quite long hours and quite hard, that we just kind of get on with it? Do you think that's kind of, because meeting obviously on ships people from all over the world, they don't seem to have the same mentality. Yeah. Do you think that's kind of a fault in our health system, that we just learn to deal with it? Or do you think that's kind of like a pro South African deal with stress kind of thing? I think, it's nice to have resilience, but I do think we sacrifice our physical and mental health to
give everything to a system, and if you can't give everything, then you're not good enough. And I think that's where like our system needs to learn and adapt and grow to say, you're not your best doctor when you're burnt out. You're not giving as much as you could. So if we actually reduced your hours, you could actually be more efficient and more effective and provide better care. So seeing what some friends and colleagues have been exposed to in terms of hours in Europe, like for example, it's a whole different world. We had an exchange student from Austria who, after her first shift with us, said, Riya, just come work here, because any one of your emergencies would take our whole team, and like that would be the only emergency. And she's like, you'd love it. So
foreign concept does.
Yeah, I definitely think we could retain our great South African doctors if we had a system that didn't burn them out.
And why do you think that that's not kind of, because obviously I know when we were in medical school, I think more during internship, there was this whole movement against doctors that were tired and
the long hours,
their cars and the long hours and things like that. But it doesn't seem like much has changed. Does it kind of benefit the healthcare system to just kind of carry on, or do you think that there is a drive to change something?
I think sometimes it's sort of short-sighted on the budget side of, if we change this, we'll have to employ more doctors or do this. I think, some of us would be willing to work for slightly less if we could have reasonable hours. So I think it's just a little bit of short-sightedness saying like we're not willing to change the whole system. I don't think.
Not going to change anytime soon.
It's hard. I mean, that set of protests and things changed it to capping young doctors' hours at 24 hours. That I think that was the outcome of that. But we often stayed longer anyway because
the work needed to be done.
Your patient needed to do. Your reg was still there. I think where it did help was when they were being given like unfair workloads and like other people weren't pulling their weight. But it does feel hard to say, you know what, not my problem. You guys have this now. It's 8 o'clock. I can go home.